Hi, I'm Dr. Mark Lewinter, licensed acupuncturist at Metro Acupuncture in Atlanta, Georgia. And I'm with my lovely co host, Dr. Andrea Lewinter, who is my mom and also my acupuncture partner. Mom, how are you doing today?
I'm doing great. How are you?
Doing great. You excited about today's topic?
I'm very excited about today's topic.
Me too. I think it's an important topic. And what we're going to be discussing today is low back pain during pregnancy. As you know, a large part of our practice is working with patients who've been diagnosed with infertility or doing IVF or IUI. And many of those patients become pregnant. And many of those patients continue their acupuncture treatments throughout their pregnancy. So we do see patients with low back pain, and it's very rewarding to help treat patients during a time where they're excited and their wish has come true. But when one is experiencing pain, that excitement can be a little bit more challenging. And to be able to reduce pain is very rewarding as a practitioner. So I'm glad that we can talk about this topic today.
Yeah, Mark, I think what a couple of things that you said is that this is a very exciting time for many women. Some have really gone through a lot to try to get to this point, and then to have to suffer with low back pain or pelvic pain. It's a significant issue and draws away from the joy of the experience.
What I love about acupuncture is it can be safe and effective. And when I was preparing for our conversation today, I was reviewing a little bit of the statistics about low back pain during pregnancy and kind of why it occurs. And I know that many of these things are very obvious, but I think it can be valuable to say is one of the reasons why there's low back pain during pregnancy is simply the weight gain, which also causes postural changes. So as the pregnancy progresses and the fetus grows, there's also increased fluids and added weight to the abdomen. And this extra weight can shift the woman's center of gravity forward, causing her to lean back more than usual in order to maintain balance. And this is one of the reasons why there can be low back pain.
Yes. And there's a lot of hormonal changes that are happening throughout the entire pregnancy, not just the beginning of it, which is usually associated with nausea. So, yeah, there's continuing, the body is continuing to prepare for the birth of this child.
Yes, and hormones that are incredibly important, like relaxin, which is released during the pregnancy to help loosen ligaments in the pelvis and prepare for childbirth. And it's totally necessary, but it can also cause generalized joint laxicity or looseness in the spine, which can lead to instability and pain when standing, walking, changing positions.
Yeah, we see this very frequently with patients that come to us throughout their entire pregnancy. At some point, they'll complain about these kinds of aches and pains.
And if people were managing their low back pain with different exercises or stretches, they may be
Yes.
limited what they can do during their pregnancy. So things that had worked in the past to keep them healthy, they're not able to do when they're pregnant. So that also can be a challenge. I was surprised to hear that anywhere from 50 to 80% of pregnant women report experiencing low back pain at some point in their pregnancy. And of those patients who experience low back pain, about 10 to 30% will rate the pain severe enough to impact their daily activities like walking, standing, working, even sleeping.
Yes, I've read the statistics as well. And, as we've talked about, it's not an uncommon thing for women, and particularly in their seventh, eighth, 9
Yeah.
month,
And
just release to start showing up.
and it can even occur earlier. I've had patients who have experienced significant low back pain a few weeks into their first trimester. That can be concerning, but if they're working with their reproductive endocrinologist or OBGYN and everything's cleared and it's just general low back pain, then I believe that we can help. What also is good to know is that many women experience relief after delivery, but It is estimated that about 20 to 30% will continue to report low back pain for weeks, even months postpartum. And then a smaller percentage, around 5 to 10%, may have persistent pain beyond 1 year after giving birth.
I think that's where acupuncture fits in so nicely. Acupuncture is something that will help women get through these various phases. They may continue to have discomfort, but it may be significantly less than if they would not have had acupuncture. So I think it's one of those things that, and I so often say this, is that it's safe and it's not painful and it's relatively non-invasive. And sometimes women come in and they're fearful of acupuncture during their pregnancy because they've heard that there's points that can stimulate labor and so on. So we know what those points are and we don't do them. And the points that we use and be helpful with lower back pain are very safe to use throughout the entire pregnancy.
Yes. And position is also a question that is asked. So patients generally lay on their side. Many patients lay on their left side, but for the short time that we're going to be doing the treatment, they could lay on the left or right side. Many lay on their left. And then needles are placed on the low back, but according to the principles of East Asian medicine, what is above it can affect below, what is below can affect above. So we'll do points all along the back, kind of working with some large muscle groups and see if we can relax the back. We talked about the weight gain and how that affects someone's balance, but also I think that just simply the stress, it can be a good stress and an excitement, but it also can be the body may not know what the difference between good stress and bad stress. And when one just gets tight and they're already their center of gravity is off, there can be pain. So the acupuncture relaxes the whole body. I've found personally, there are times where I may have, low back pain, and I'll give myself a treatment, and I'll place a couple points in my hand, and just the relaxing effect of acupuncture, it within just a few minutes can help decrease the back pain that I'm experiencing. So and that can last for several days. Sometimes it can be curative of the backache episode that I was experiencing. I do think that it can be a little bit of an uphill battle when we're working with patients who are pregnant and they're until they deliver, they're only going to get bigger. They're only going to experience more weight gain, more pressure. But if there can be temporary relief, that can be a fantastic thing because they're going to be able to sleep better, feel better, do the important tasks that they need to do throughout the day.
Mhm.
So even if it's temporary relief, it can be safe and effective temporary relief.
Yeah. Yes, I agree. And temporary relief could be relief from the pain, or it could be that the pain just softens and it's not as severe as it was. So those are all win situations.
And many women who are pregnant are looking for natural ways to keep themselves healthy or help themselves feel better. And acupuncture just encourages the body's own capacity to heal. So it increases function. It'll help relax the muscles, increase blood flow, decrease inflammation. So some people ask, is there any medicine on the needle? No, what acupuncture is a intentional micro trauma. This needle enters the body and then the muscles recognize that as a disturbance, the circulatory system recognizes that as a disturbance, the nervous system recognizes it as a disturbance, and changes happen. So it's not that we're injecting any medicine, we're just creating a little micro trauma, and that can bring the body back to homeostasis or balance.
Yes. And it's such an easy, safe, and relatively non invasive thing to do.
That's right. I was wondering, did you have back pain during your pregnancies?
I don't remember, not until the very end, of pregnancy, which when I say the very end is like the labor and delivery, there was back pain at that time.
Yeah.
But throughout my pregnancy, no, I didn't have back pain.
Yeah.
Um, I was also very active. So I think that's another thing. And there's a lot of support now, yoga for pregnant women, exercise classes specifically designed for pregnancy, massage therapists that work with pregnant women. So I think there's a lot of tools out now that can be very, very helpful.
Yeah, absolutely. And it often may require more than just one thing. So acupuncture
That's
can be
right.
part of the entire process of making it through a pregnancy feeling good and being healthy. I I am in general, younger people tend to have less back pain. Older people tend to have more back pain. By no means are the patients that we're seeing old, but many of the patients that we're seeing are patients who have been diagnosed with infertility, are doing IVF, are over 35 years old, and they have for months, years, worked very hard to try to get pregnant.
Mm.
That's included significant, highs and celebrations and joys, and sometimes lows, sadness, grief, loss, frustration, and many other things. So, already someone is wanting to get pregnant, they may look at just getting pregnant as a finish line.
An end goal.
Yeah, we just wanna get there. And then what I've found, and I used to think that too when I started working with patients who were wanting to get pregnant almost 25 years ago. Like, let's just get to that point. But then they get pregnant and they realize there's a whole 'nother journey that needs to be accomplished, which is also incredibly taxing and has its own, emotional challenges and excitements. So, I think that when someone gets pregnant and they've already been kind of pushing their body and already been stressed out, it's even more important to continue to do things that help manage the stress. I say it probably almost every time. It's better to dig the well before you're thirsty. So, adding in things like acupuncture, yoga, massage before you get pregnant, during a pregnancy, I believe can be very, very helpful.
Well, I'd just like to kind of reiterate what you said about, people older, people that are in their 20s are very active and moving is easier. They can, if they chose to, could do cartwheels. Well, at 35 or 40, you're probably not doing cartwheels anymore. So there's that level of flexibility, there's that level of physical stamina that is changing unless that person really was doing exercising and again, it doesn't have to be rigorous exercising, but keeping that flexibility. And when we talk about women wanting to get pregnant, so many women really, even before they start that road with IVF or intentionally trying to get pregnant are looking at diet and exercise and making adjustments to lifestyle so that this can be a very successful and enjoyable time. And I've seen that with people that I've treated that have been on this road for many years and have taken care of themselves. And yes, there's that emotional up and down, but I think that piece of self-care is really so important before, during, and after. And that's one of the things that I say to my patients is that after you have this child, come back because you have just experienced trauma. There's blood loss, there was pain, there was discomfort. It may have been during the pregnancy, but it may have been through delivery. So come back so that you can get stability and feel better while you're taking care of this little gift from the heavens.
Yes, and this little gift from the heavens has weight to it,
That's
so,
right.
like, you're picking something, picking your baby up, holding your baby, moving in these, all sorts of unusual ways. So, there's just a lot of different body mechanics that are happening that haven't happened before. So, the pregnancy is no joke. It's hard on the body, and then the baby comes, and it's a tremendous amount of work. So, if you know that you're susceptible to low back pain, do those self-care techniques, and if acupuncture can be part of that, we're glad to help you. We love doing it. If you don't have back pain, but you wanna work on your wellness and an an ounce of prevention is worth a pound of cure, then we would be glad to just support you and keep you healthy. And, of course, we're Metro Acupuncture in Atlanta, Georgia, and you can schedule appointments at metroacupuncture.com, and we see patients Monday through Saturday.
'Cause we're here to help you dig the well before you're
Dig
thirsty.
that well before you're thirsty. I noticed it's winter time, and we're both wearing a sweater, and I thought according to the principles of 5 element, a category of East Asian medicine, wintertime is also the water time and a time that's susceptible to low back, so I felt like this was seasonally a great conversation to happen. It's cold outside, huh?
It's cold outside.
Cold outside. Cold outside, gotta keep the low back warm
And around the neck.
and around the neck. Yeah,
Yeah.
yeah. So, all sorts of ancient wisdom that East Asian medicine provides and how to care for oneself throughout the seasons and really how to care for oneself during all stages of life, including pregnancy. Okay, well, that's all for today, and we look forward to talking with you next time.
Thank you for your listening.
Bye-bye.